So I'm going to tell you a little bit about, I suppose, digital jobs, digital careers in the NHS, and why now is the most exciting time to join the NHS in one of those roles. I'm going to do it through the medium of my own career, which has been, like many chief information officers, I suppose many digital experts or people in digital careers of my age, it's been, well, let's just say it's been a portfolio career. It's been varied. And that's been really good for me, actually. It's enabled me to understand different aspects of what digital means for the NHS and for the people we serve. And I suppose in good digital tradition, I am really keen on any feedback you'd like to provide me. My Twitter handle is @JamesFreed5. If you want to let me know how it went, or if there was anything in particular you liked or didn't like, feel free. I would very much like to hear from you. Okay. So let me start by explaining what I mean by digital. So digital is one of those words that means a lot of different things to a lot of different people. And what I use the term digital to mean is partly anyone who works, if I talk about digital career, I mean anyone who works predominantly with data, information, knowledge, technology, or change that involves those four things as the main part of their job. Now, digital's got other meanings as well, of course, and increasingly it's around philosophy, ethos, and the way in which we do work. And part of my current job is helping people understand what that means for them and their own practice. But for now, and for the purpose of this talk, I'm going to rewind 22 years, actually, to the point at which I've just finished my degree and my master's. So I did a degree in biochemistry and genetics, I did a master's course in oncology. And then I started a PhD in molecular oncology and cancer research, working on human papillomavirus and its impact on skin cancer. And I'm going to use that experience to talk a little bit about the impact of genomics and bioinformatics and what those careers mean within the context of digital. So it's a massive growth area, you'll be unsurprised to hear. I mean, given that DNA was only discovered halfway through the previous century, we've made significant progress and significant advances. There was a report that was released last year. It was written by a gentleman called Professor Eric Topol, who is an American physician. And he was commissioned by the then Secretary of State for Health, Jeremy Hunt, to write a report on what technology means for our future workforce. If you get a chance to have a look at it, please do. It's a really good read. And one of the 10 technology groups that Eric looked at was genomics and bioinformatics. And he looked at the impact of two broad things. The first was reading the genome. That's our DNA that's in almost every cell in our bodies. And reading the genome is it enables us as the health service to help predict what might happen to you or is likely to happen to you, to look at your risk factors for things like dementia or heart disease, and thus help you make changes to your life and your lifestyle that have a direct impact on your chances of getting that disease later in life. It's revolutionary because it's starting to help us not only look at how you might prevent disease before any symptoms appear, but it also helps us think about, I suppose, the next step, which is how we might eliminate that risk entirely. There's a separate technology around writing the genome, which is just starting to come into its own, really. But we won't be seeing that for a significant amount of time yet. But maybe by the time you're my age, you'll be a practitioner in it. The writing the genome helps us target specific parts of our DNA and change it, either getting rid of what we call deleterious genes, harmful genes in our bodies, or perhaps introducing genes that are absent that are necessary for long, healthy lives. So in 2001, I decided that bench science wasn't for me, and I went to work in hospitals in southwest London. And that's where I will introduce my second broad category of careers in the digital world. And that's around change management and project management. Change, as they say, is the one constant. And it is a tremendously fast moving area. The world is changing faster than it ever has. And that is more true in the technology world, in the digital world, than anywhere else. There's a gentleman called Gordon Moore, who back in the 1960s, along with a few friends, invented the computer chip. He now owns Intel, which is a significantly profitable business, and is responsible for most of the computer chips and most of the PCs in most of the world. He was asked to think about change, and he proposed something called Moore's Law. And what Moore's Law stated in the 60s was that the power of computer chips, as measured by the number of components on a computer chip of roughly the same size and roughly the same cost, will double every year. Now, Gordon changed his law in the next decade, in the 70s, to say that actually that rate of progress is slowing slightly. It's doubling every 2 years. But that trend has continued ever since. We have seen an exponential doubling every 2 years of the power of technology, and that is mimicked by the power of data and the power of knowledge. The volumes of data and knowledge that are available to us double also, and we see this exponential rise across the world. What this means is the opportunity for us to solve problems is also doubling every 2 years. I'll just give you a quick example in terms of what that really means. Back in 1994, the most powerful computer in the world was a computer called Deep Blue. It managed the logistics for the American military, and it was unparalleled, unrivaled. Today, downstairs in my lounge, I have a PlayStation 4, and that is roughly the same power as Deep Blue. And in 2 years' time, the doubling will double again. And 2 years after that, it will double again. That's the entirety of everything from the 1960s to today. All of that progress will double in the next 2 years. It's scary. What change managers and project managers do is help capture that, recognize that that change is difficult to manage sometimes, and to make it palatable and likely to succeed. They have skills around project management, of course, but also, and increasingly importantly, people management. And the NHS has got a huge need to be able to use the opportunity that digital provides, data information knowledge and technology provides, and translate that into real change for real benefit. So in 2003, I stopped doing that work and recognized that I wanted to get more in the technology world. I joined something called the National Programme for IT, or Connecting for Health. And its role as a national organization was to digitize technology in the NHS. It was to create information systems in every single hospital and every single GP surgery, and link them together, digitize patient records and enable that data to be encoded and used. Now, it didn't quite succeed in the way it wanted to, but its legacy lives on. And whilst we are still trying to digitize in some parts of the NHS, the language has moved on and the aim has moved on. We now talk much more about interconnectivity or interoperability. That's stitching together those different islands of zeros and ones that sit within hospitals, within GP surgeries, within social care, to enable us to share information about individuals, whether they're patients or service users, for their net gain. So as I get older, as all of us get older, I'm afraid to say, we accrue long-term conditions. And it's more important for that information to be shared because we're under the care of more and more clinicians and more professionals. And so that interconnectivity is absolutely necessary if we want patient-centered care and if we want to try and save lives. But the technology piece doesn't end there. The top of the review identified a number of other areas, the role of apps, for instance. We're increasingly empowering patients and the public to take more control of their own destiny, their own healthcare, and helping them make better choices with their lives in terms of their health, giving up smoking, eating more healthily, taking more exercise, for instance, and using things like nudge theory and cognitive behavioral therapy through apps to change the public's behavior. This, coupled with the power of the phone in your pocket, means that we are also extracting more and more value from sensors and wearables, things like the Apple Watch as well, or the Samsung Watch, that measures your heart rate and your blood pressure. And increasingly, we will be taking more and more measures. I mean, the time will come very soon, I suspect, where we will be regularly using these sorts of wearables to identify problems before we've got any idea that they're coming individually, and helping us get the right attention and the right treatment before those problems, become problems. Telemedicine was also mentioned by the top of the review. This was predicted in the review, actually, and by all of the evidence at the time, to take a good 10 years before it was prevalent across health and care. COVID-19 really put pay to that argument when we had no choice but to implement telemedicine for more routine, non-urgent or even urgent, but just non-face-to-face interactions with health and care. And now we see telemedicine almost ubiquitously across the health service. It's an area of growth. It's still doubling like everything else, and there are tremendous opportunities. So that takes me to 2006. And in 2006, I joined an organisation called the Health Protection Agency. It no longer exists. It became something called Public Health England, and Public Health England itself is becoming a national infectious service. But the HPA at the time was responsible for protecting the nation from all sorts of hazards, infectious disease, radiological and chemical hazards as well. And I ran an electronic library in the Health Protection Agency. Sorry, Scott, I can hear you. So I ran a library around infectious disease, and it became increasingly important to me, increasingly necessary, that I create a service that synthesized all of the knowledge that was available in infectious disease and presented it to people so they could make the right decisions. Librarians and knowledge managers in the NHS do an incredibly important job. Let me tell you a little story about a gentleman called Dr. Spock. That is not Mr. Spock, who lives on the Starship Enterprise, but Dr. Spock, who was a pediatrician back in the 1950s. He published a book on childcare, and he gave some advice around getting children to sleep. He encouraged us as parents to put our children on their stomachs and let them sleep like that, or in the prone position. We've since found out that prone position is a direct risk factor for SIDS, sudden infant death syndrome. And consequently, we've determined that advice and advice like it, so impact from bad health advice, has killed 60,000 children through sudden infant death syndrome. If you're a good knowledge manager and a good librarian, you synthesize medical information, medical research to provide the best available knowledge to frontline clinicians to make the right decisions at the right time, and to parents and the public at the right time, in order to save lives and to reduce harm. And if you're a librarian knowledge manager, you save lives. In 2012, I joined Public Health England, and this is where I will bring the data world into play. Data has a number of opportunities, exciting opportunities for us. Right now, artificial intelligence can identify, in certain areas, in radiology and pathology, image interpretation better than human beings. And it's only getting better. Predictive analytics has started to come into the play as well, which means that we are able to predict when someone is poorly based on their behavioral activity or based on other physiological measures before they even know it themselves. Data saves lives. In 2015, I started a Health Education England, my current job, as Chief Information Officer. And as part of that role, as James mentioned right at the beginning, I run a program around digital readiness. And it's my role to help, well, bluntly, people like you get jobs like mine and keep you in the NHS. It's a tremendously exciting time, but it's also, it's uncertain. That curve that I talked to you about right at the beginning, exponential change dictated by Moore's law, it means that it's harder and harder for us to predict what the future is going to be like. In fact, if I can quote from the top of the review just for a second, we need to prepare students for jobs that have not yet been created, technologies that have not yet been invented, and problems that we don't yet know will arise. What that means is we need a workforce that is flexible and willing to learn and able to apply the things that they know about technology, data, information, knowledge, and change to the problems that we have in the health and care system. To do that and to help you join, we've created a number of things. We've done that because demand for these roles is increasing. Out of a total workforce in the NHS of about 1.4 million, there are about half who are non-clinical. And of those, about 50,000 are informaticians in the NHS, digital professionals. McKinsey estimate that there will be a 75% increase in the number of digital staff required in health and care services and health and care industries in Western Europe by 2030. That is a substantial increase, maybe a 35,000 person increase across the NHS in the next 10 years. So there's huge demand, there's huge opportunity for you. And we're trying to do things also to support you into those roles. We've increased our thinking around professionalism, about just defining what good looks like and helping people reach that bar. We've created a federation of informatics professionals that links together existing professional bodies, and the Faculty of Clinical Informatics, which recognises an entirely new profession of informaticians who are also clinicians. We've developed career pathways so that no matter what job you're doing, you will be supported to progress throughout the NHS until you become a chief information officer or a chief executive officer for that matter. We've invested in apprenticeships and in specific schemes for new starters. So things like the Fast Futures programme aimed at school leavers and university leavers to develop digital skills that will help them in their first roles in the 21st century. And also the DDAT, that stands for Digital Data and Technology Graduates into Health scheme, which is a more structured 1 or 2 year apprenticeship programme coupled with a job in the NHS. We've invested in training. The NHS Digital Academy is something that we've invested in. Rachel Dunscombe spoke to you earlier on today, who's the Chief Executive of the Digital Academy. That brand has been expanded so that it supports all people at all stages in their career. In short, ladies and gents, digital, data, information, knowledge, technology, and change, they save lives. They save significant lives. And we'd really like you to help us save some lives. Thank you.